This is Dr. Steve with AdvoCare Clinic. Today we're going to discuss the reasons why it makes sense to get your medical marijuana card. First, we need to talk about the different strains of cannabis. Cannabis comes in three basic varieties: indica, sativa, and hybrid. Indicas are what we call indicouch. They're your relaxing strains. They're great for pain. They relax your anxiety, they make you sleepy, and they help with nausea. So indicas are indicouch. Sativas are what we call stargazers. Sativas open your mind, increase your creativity. They wake you up, perk you up, and energize you. The reason we call them stargazers is for most people, if they use a sativa at night, they'll be laying in bed, looking at the stars, contemplating the universe. Hybrids are interesting. Hybrids are like the child of an indica and a sativa. They can look a lot like mom, they can look a lot like dad, or somewhere in the middle like Aunt Sally or Uncle Joe. But usually a hybrid will either lean one way or the other, more like an indica or a sativa. So those are some of the basic things you need to understand about the strains. Now let's talk about why should you get your medical marijuana card. First, safe products. I'm an emergency medicine physician. I still practice emergency medicine part of the week. And one thing that we see is dusting. What dusting is when somebody has a bad crop, but they want to move it and make the money, they will put things on it to make it feel like it's causing a psychoactive effect. Those substances can be very harmful, and sometimes it's carfentanil. Carfentanil is an elephant tranquilizer. It's what people overdose on when they have an opiate use disorder and results in death a lot of the time. So for safety purposes, street weed or weed from places that you don't know can be very, very dangerous. Number one. Number two, reproducibility of results. If you're going to treat cannabis like a medicine, just like a prescription med, you want to know what the dose is. So if you don't know your percentage, you don't know your strain type, how are you going to be able to modulate your dose to get the best response for you? So for reproducibility of results, it's nice to have a place to go, just like a pharmacy. You have a dispensary, and they have qualified people there that will help you make good decisions to achieve the results that you're looking for to best serve your needs. So reproducibility is very important. 3, variety of dosage forms. This is key. When we build a program for a chronic pain patient, for instance, there's 5 phases to that program. There's a phase to manage their baseline everyday pain, and that's usually with some form of an edible or tincture because they last longer and you need them to be in effect for a longer period of time. There's a rescue component where we would use a vape form because we need it to work quick. With chronic pain, when it gets exacerbated or spikes, you have to get after it quickly or it gets out of control. It's very similar to a horse in a barn with no bridle. If that horse gets out of its stall and is headed for the barn door, and you see it going there, if you can throw a rope around his neck and turn his head back into the barn, you can keep him from hitting pasture and getting way out of control. If he hits pasture and you don't bridle him in, he's gone. And that's what happens with chronic pain when it becomes exacerbated or spikes. It doesn't go like this, it goes like this. It's parabolic or exponential. The key is to hit it here, turn it around, and bring it back into your baseline pain zone. And when you're not having spikes, you can touch up your baseline pain regimen with a little bit of vape to even increase your relief. A third component is a sleep program. Chronic pain patients suffer from sleep issues a lot of the time. And when you don't sleep well, you don't feel well. Sleep is restorative. It is a natural phenomenon. When you sleep well, your body heals and you do better. So we build what's called an induction phase, continuation phase sleep program. What that means is with induction, you want something that works fairly quickly, comes online, gets them that sleepy, relaxed so they can fall asleep. And then you use a longer acting form like an edible that you take about the time you go to bed. And as the one is coming down, the other one's coming up so that the whole arc looks like this. And it gives them about 6 to 8 hours of good sleep. So there's a sleep program component that's very, very important. The fourth component is for people when they don't feel like getting up and getting going. That's when a sativa makes a lot of sense. Remember, we talked about them being energizing, wake you up, perk you up, get you going in the day and give you a good outlook. Well, you could use a little sativa on those days. You don't have to use it every day, but when you need it, it needs to be part of the program. And that can be a tincture, a vape, or an edible, depending on what your time frame is. The fifth component is what we call a social lubricant. And basically, what that means is using cannabis for the purposes of relaxation when you want to go out for a nice evening. We'd much rather use a nice hybrid for a little bit and not go out and drink 3 vodka martinis. Alcohol is a toxin. So a good trade-off is to use a little bit of a hybrid, maybe a little indica, to help you feel relaxed and enjoy your evening in place of using excessive alcohol. Consistent supply. So let's say that you do get your marijuana from a friend or off the street, and you find a batch that really works great, but the next batch just doesn't do it. It doesn't get you where you need to be. It doesn't help with your symptoms. So now you're fishing around, and it's a very unknown, uncharted water that you're in because you just don't know what you're getting. So consistent supply matters if you want to reproduce your results and be able to have a true medical program that you can count on a day-to-day basis. Another thing is you're able to transport your medicine legally. If you buy marijuana off the street and you want to transport it and you get pulled over, it's illegal. If you have your medical card and a true medical indication, you can transport that medicine legally. A couple key points though. You don't want to have your device within reach. It's no different than an OVI where you have a mixed drink sitting in your console when you get pulled over. The medicine needs to be secured and put out of the reach of anybody in the vehicle. When you transport, you want to be safe and careful with your medicine. The other thing is legitimacy. A lot of people benefit from knowing that they have a medical practitioner involved in their care, helping them make good decisions for their medical cannabis program and overall health. Legitimacy has been one of the biggest benefits that people report after being in the program as little as 6 to 8 weeks on their follow-up visit. The other thing that people talk about is not looking over their shoulder anymore. They've been maybe a user that's self-medicated for years, and now they're able to do so and not feel that shame or that concern or paranoia that someone's going to find out or that something bad's going to happen. So for that reason, people really feel a lot of relief when they get their medical card and participate in a legitimate program. This is Dr. Steve with AdvoCare Clinic. This is the why and the how to get your medical marijuana card. Look us up at advocareclinic.com or call us today at 330-754-4850 to book your appointment for holistic healing. Have a good evening.